thank you so much for joining us here today. My name is Clay Carrington. I'm the Executive Director of the Canadian Blockchain Consortium, and I'm really excited for today's panel, which is Digital Passports and the Future of Health. So this topic will be discussing how the pandemic has created a new momentum around blockchain solutions for managing identity and health data, including the secure transfer of private data for COVID-19 test results and vaccination statuses. However, privacy concerns around the use of digital health passports are posing challenges to adoption, resulting in the continuation of efficient and costly time-based paper systems. So that will be our discussion topic for today. I always like to start a little bit about who we are. So if you're a new time viewer, thank you so much for joining. If you are used to joining our webinars, thank you so much for coming back. Our consortium's been around since about 2017. We're currently the largest not-for-profit industry organization across Canada. So we're so happy to be able to serve our country, being able to provide advocacy, education, promotion, marketing, and project support to companies all across the country. We started from an incredible woman. I always love to talk about her. Her name's Suzanne West. So this was her baby, her brainchild, and she wanted to see how blockchain could actually transform the oil and gas sector. So we've been keeping this going to keep her legacy going. She was an absolutely incredible woman and truly believes in the transformative power of blockchain. Of course, as a not-for-profit organization, we really couldn't do what we're doing without the incredible support of all of our members. So big shout out and massive thank you to everybody on the screen. Many of them have been with us since day one, and we're so glad that we have such a growing community. And of course, today's topic, webinar is being sponsored by TrustBix. What an incredible company, and you're going to be hearing their CEO, Hubert Lau, as your moderator today. But TrustBix has been around for a while now, and they do birth to burger and supply chain management, building value chains. So if you're interested in learning more about them, www.trustbix.com. They are an incredible company, and you'll hear a lot more about them during today's webinar. We do love it when everyone engages with us. So please, please, please ask questions. This amazing panel of experts is here to answer any question relative to this topic, I will say, happening today. So please also make sure to type your questions into the Q&A bar spot. It's a little harder when you type them into the chat. We love when you communicate in the chat, but if you have any questions, please post them there and they'll be sure to get to them. Of course, please also engage with us. We're on LinkedIn, Twitter, Facebook. If you like anything our panelists have to say and want to tweet it out, we will also like and share and comment. Just use the hashtag Canada Blockchain. One of the other things that, of course, we're proud about is we have a free magazine. It comes out on the 1st of every month. There is a lot of research that goes into this to keep you up to date and informed on all the incredible things that are happening across the country in terms of blockchain. And this one on July was all about the insights we learned from the Bitcoin Miami conference, which was the largest Bitcoin conference that has happened, 12,000 people. So lots of interesting learning and education and some great interviews from that one. So again, it's a free resource. If you want to check it out at canadablockchain.ca, you'll be able to see all the different magazine issues that we've had so far. So without further ado, I'm going to introduce you to your incredible moderator for today, Hubert Lau. So I've known Hubert for a while now. He is probably one of the most fun and engaging people I have met in this space. I hope you don't mind me calling you this, but he likes to call himself a Chinese cowboy, which I really he is a brilliant businessman, taken his company TrustBix public, and a very, very dear friend. So I'm going to hand over to Hubert to introduce all the other incredible panelists that you guys have here today. And Hubert, take it away.
Well, thank you, Kalea, and hello, everybody. We're very excited to have this discussion today about digital identity and healthcare and passport and so forth. And I just want to give a shout out to our whole community, to our Indigenous communities, that our hearts are with you, and that it is very sad to see the atrocities that's happened. But as a nation, as people, I just want to invite that we all remember that we're all individuals. That is part of many, many different aspects and attributes. So I look at this panel and I don't see color, I don't see gender, I don't see any. I see fantastic people and individuals that I'm so glad to call colleagues and fellow panelists today. So just wanted to have a shout out to our communities and that our love and heart are with you. So with that, I'm gonna kick off, and I'm just gonna go around the screen here. So I'm gonna start right at the top here. If we can do the introductions, I'm gonna ask each one of you panels to do the introductions, but I don't want you to be too Canadian. I want you to don't to be too humble. I want you to really, really talk about who you are, where you come from, where you are currently physically, because some of you are not in the country. But really importantly, why should we listen to you today? Okay. So Stephen, if I can, since you got that really cool shirt on, and I'm gonna ask you to go first, Stephen.
Sure. Steve Curran. I am a consultant in blockchain identity for about 4 years. Got into things going on in the Hyperledger world, and Hyperledger Aries and Indy, and verifiable credentials. So my gig is really about verifiable credentials and how they can get used. I do a lot of work for the BC Gov. So if you look me up on Hyperledger, you'll often see that I'm talking about BC Gov and representing BC Gov. I am not with BC Gov, and nothing I say reflects the positions and statements of the British Columbia government. So let me make that very clear. However, they are leaders in digital identity. They do a fantastic, they have a number of fantastic programs, and they're doing a lot of really innovative work, of which I get to participate in. For those also who are aware of decentralized identity, I'm the vice chair of the Sovereign Foundation, and that is a global nonprofit that operates the largest blockchain for identity instance. So that's most of it. I am in the Netherlands today, so it is late at night. I will be having wine very shortly, and I'm visiting my granddaughter, who is almost 3 months old.
Wow, that's fantastic, and I'm so glad that you're calling in from the Netherlands, and hopefully you're wearing those funny shoes as we're talking. Okay, yes. Fantastic. So Sid, you look like some sort of a rock star or professional football player. So we're really dying to hear about you and your background.
I wish that would have been awesome, but my name is Sid Sharma. I'm the CEO and founder of Free Human. So why you should listen to me is because I think me and my team, we have been involved in blockchain space since 2016. And in 2018, we came across actually Sovereign Foundation. That's how I met Stephen. And we got involved in World Wide Web Consortium, started working with Hyperledger, Decentralized Identity Foundation. We are constantly contributors to the Verifiable Credentials group. And we are Identity as a Service company. So we have our own solution, which we initially created for the employers. Now we are expanding that into insurance and health sector and other industries. And we have offices in Canada, US, and 6 months ago, we opened a branch in Africa. And right now I'm in Africa, and we are evangelizing decentralized identity here.
Wow, I can see you're getting a fantastic tan. So. So next we have Alexis, and Alexis, is that a real background? Is that a virtual background? Because it looks amazing.
Thank you so much. Yes, this is my loft in downtown Calgary. So nowhere nearly as exotic as Netherlands or Africa, but yeah, very excited to be here today. I'm the executive director of the Canadian Blockchain Association for Women. I'm the director of industry digitalization for the Canadian Blockchain Consortium, and been on an amazing journey with Kalea since she took it over a couple of years ago. It's been fantastic to be a part of its growth. I'm also the editor of the magazine that she was discussing earlier, and it's just amazing to be a part of sharing the amazing narratives and stories that are coming out of the blockchain ecosystem in Canada. And last year, I partnered with a company called Guild One. They're a blockchain solutions firm based here in Calgary that specialize in energy industry transactions, and have started branching out into other industries. And we worked together on the development of a blockchain health passport for COVID-19 testing and vaccination results. So while digital identity isn't really my specialization, which is more on the industry applications and ESG side, it's been just an incredible journey. I've learned a lot, and I'm excited to share some of the insights I've gained over the last year. So great to be here.
Oh, fantastic. Thank you, Alexis. And last but not least, with the coolest hairdo in the panel is Eric. Eric, please introduce yourself.
Why, thank you. Why, thank you. Yes, as I was saying earlier, this is what happens after like 9 months of lockdown. I'm in Toronto and haven't been able to get a haircut for about that long now. So this is just what happens, but I appreciate the compliment. And I'm VP of Product Innovation at Convergence Tech. We're a digital transformation and tech development company. And on the tech development side, we do a lot of work internationally, I guess, with blockchain, having worked with governments and agencies like the United Nations around the world to kind of deploy and develop solutions, pilot in full scale across a wide range of landscapes, having done work on the ground in places like Mongolia, Singapore, Thailand, Afghanistan, doing some work in Uzbekistan and Morocco right now virtually as well. So we kind of have a good sense of some of the challenges of practically deploying some of these things into some of these sort of remote and rural environments, as well as then actually building foundational infrastructure to try and help these things scale at like a government level. So lots of blockchain work there. And then the other thing we do is related to digital and decentralized identity. So do a lot of work there as well across the education and healthcare spaces, increasingly getting into government and digital identity wallets and credentials-based identity models, either from a conceptual or a deployment and implementation and development stage. And then relevant to this conversation, certainly in line with that, is our work we did earlier this year in Singapore, being one of the companies helping with the deployment of health certs across the country there. So we got to integrate our tech with a lab network and about 450 clinics to be able to issue COVID-19 negative test results for the purposes of pre-departure checks on travel as they're exiting the country. So it's one of those early, larger scale deployment and issuance of some of these sort of concepts of COVID passports or COVID tests that is certainly getting a lot more prevalent and complicated as we move into the world of crossing borders, enabling international travel, and moving into something a lot more permanent than just a test, and that's a vaccination that might have to sort of persist, well, for your lifetime. I guess we'll see how long these things last, but very interesting times, I guess, as far as sort of the deployment of some of this tech. Very interesting opportunity to sort of get some of this out in the real world and work out these kind of kinks and really sort of create those pathways forward for where this can go and what else it could be used for. So exciting stuff.
This is great. We've got, so for everyone in the audience here, we've got 4 panelists with real commercializable or commercialized solutions. And that's one of the reasons why we want to do this panel for everyone today, is that we don't want to be focused on theoretical discussions, what could be or what should be, but really wanting to talk to individuals who represent companies and projects that are making it happen. And as many of us in the tech world knows, that there's something called the chasm of death, where there's great ideas and technologies that never make it through that chasm and it dies. So these 4 panelists really today is going to talk to us of how they're not just only crossing the chasm, they're leaping over the chasm. And so we're looking forward to a discussion where we're talking about real life samples of what's being done. So panelists, I'm just gonna pop our first question here. There's a lot of debate around COVID-19 health passports. And has been going on since the beginning of the pandemic. So we're all tired of that discussion. So with recent statements from the World Health Organization, caution against their use, what do you think is the likelihood near-term adoption? So again, real life ideas and thoughts. So please, who would like to speak up first?
I can go ahead on this one because I was just reading a really interesting article on South Korea and the blockchain-based vaccination certifications that they're now making mandatory. So we actually are seeing some evidence that, not in Europe and not in North America, but there is a commitment globally to having a more efficient and digital solution to verification of COVID and vaccination status beyond just the little pieces of paper that everyone's kind of been making fun of. So there are definitely some big moves going on globally. I think Asia is going to be leading And from my experience in dealing with the government of Canada, as well as some states in the US, they really want to see public demand for this type of solution before they're going to enthusiastically move forward. And that public relations challenge and public buy-in is the biggest adoption hurdle that I've seen and experienced.
Fantastic. Thank you, Alexis. And I've got some follow-up questions on that, but I want to give a chance for the other panelists to also chime in so that we can kind of consolidate those ideas.
Yeah, I think if I could jump in, having just traveled, I can tell you that even with nobody flying, it's highly inefficient the way it's happening today, with me showing the piece of paper that I printed on an inkjet printer to show the airlines that I've been vaccinated. So I think it is going to happen with the crossing jurisdictions, because nobody wants anyone who hasn't been vaccinated to come into their territory, their land. I think that's going to be the driver. The big thing, I think, the other couple of drivers that could be is this idea that you could encourage people to get vaccinated by allowing extra priority for people who have been, and it can demonstrate that. I think that could be. I think the big thing, though, to have it internally would be if another wave comes out that affects the economy, that keeps things shut down and prevents things from going forward. I think those are the kind of drivers. It is a very difficult challenge to do it. I think the global travel is really difficult. So that's the thing that's pushing against the work is how complicated it is.
I just want to jump in. I think Stephen and Alexis hit the point, but I think the economic and health reasons are driving this more so forward. However, we have to be a little bit conscious of people who are not that open to getting vaccines or vaccine passports. And I think especially when we use a term like passport, right?
Absolutely.
That comes with so much baggage, right? I'm not a genius at naming anything, but I think we should maybe call certificates or maybe immunizations something that's not a passport, because that just sends such a fear to everybody that, hey, are my rights taken away? Am I not getting? So I'm a technologist, like I love this technology, but I don't think there should be anything that's out there that excludes people from anything. So I hope we can find some kind of common ground where we are not excluding anybody from any kind of services or anything. But I do think just the way Asia is going and other parts of the world, Israel and you name it, I think this seems like the economic driver to do the right thing.
Yeah, and I think that's probably one of the elements here is an important distinction around it, in that a lot of the reservations and concerns are, it's an ethical quagmire as soon as you get into countries that are less developed or have multi-tier healthcare systems, or even just have digital literacy, digital access issues, where it's kind of like what permissions you tie to this thing end up being very important. And that's where I think we're at a point in the worldwide deployment of these things where we need to start looking at what these actually are. Exactly like passport, health passport's a very loaded term. A much better term, privacy preserving, in fact, if you can minimize the information in it, is like a travel token, is something that gives you just the minimal assertion you need to go do something and cross borders. Because I don't think hopping on a plane is too contentious. We have to jump through so many different hoops. We have yellow card or yellow book vaccines. You need something like yellow fever vaccines if you're going to Africa, for instance. So it's not like it's an unprecedented thing for travel. The bigger concern is when you start using it for public health reasons and start packing in like medical record data and all of the fire records and all of the big chunky information that a lot of these specs are sort of demanding, and then saying, are we really designing the same thing? Is allowing me to cross a border with a permission and an endorsement the same thing as allowing me to present my medical record to someone who probably has no business holding on to that information, even as sort of like an RP after they validated it, which is why it brings up this question of what are we creating here and how can we make it inclusive? And that probably comes down to sort of very specifically what permissions are you tying to it? Because international travel, that's something very different than domestic usage and permissions in terms of what services you can access within your country, within a population.
Stephen, I see you're trying to say something there. Yeah.
Yeah, so it also comes to a very specific divide, because I think you actually went too far in what you said. You're trying to bring it back, but quite frankly, the health industry is giving you a statement about your health. It's saying, oh, you've been vaccinated. That has nothing to do with travel. So now you have to take it out of that context and put it into the travel context. And, there's no way that, a government, BC Gov, is going to issue a credential that says you can travel. All they're going to do is give a fact that says, oh, by the way, you have been vaccinated. Here's what you had. Here's was the dose. Here was the date. What others do with that, that's a separate context and a separate set of issues. So, but absolutely right. The naming, really bad. Health passports, I'm really against that. Vaccination health passports. But the big thing we always push is the privacy and being able to limit what you disclose for whatever it is you're trying to do. And that's the really interesting part of the technology that can enable this, that we've been working on. Yeah, it's fun.
Alexis, I like to kind of circle back with you, because you've been working with the government. You started off our discussion talking about what's going to drive government adoption. You talked about public demands. Your fellow panelists are talking about economic drivers, the naming, the ethical concerns, digital literacy, and are we putting too much information, and how we're segregating the use of the information from how healthcare is using it versus travel. So I'd like to ask you, from your perspective, your experience, is how have you and Guild 1 been trying to address something like this?
Well, I mean, I think that a lot of the challenges, at least here in Canada, are due to that in order to minimize the risk of the adoption of this type of technology, blockchain health passports, verified credentials, whatever you want to call it, the government of Canada is really looking to the moves of other countries around the world to make sure that it's something that is going to be interoperable, is going to work for international travel. So I think here, while we've engaged in discussions and some planning around smaller scale pilots in conjunction with some testing and vaccination providers, for that big, large-scale adoption for something like international travel, I think we're going to be following the rest of the world rather than the innovation kind of generating from Canada, and that's really my impression. And there are a lot of very good reasons for that. This is certainly a risky move. I think that from a government standpoint, adopting a technology that is so new and isn't in widespread use throughout other functions in the government is very challenging for them. I think that if blockchain had a greater level of adoption, for all kinds of public service processes, like this wouldn't be such a huge hurdle. But yeah, so there are a lot of reasons that we're moving a little bit slower from a government standpoint. I would say that one of the more interesting projects that I've been working on, and something that I think could have a lot of potential, is for Indigenous communities and some of the needs there around secure medical data sharing, as well as digital prescriptions. So that's something that I'm really excited about, and I think that that's a project that could have a lot of benefits going forward for disadvantaged communities.
I love that. Sid, when we talk about disadvantaged communities, Africa has all kinds of challenges. Could you share with us what you're learning, and how does that compare to what Alexis just shared with us?
So it's about how we position it. So each time if I go and talk about that we are creating a technology that's blockchain based, you will lose somebody right away. If I go and talk to the officials here that we have tamper-proof credentials, then no one can fake or replicate. That connects more. And again, just like Eric said, like I'm not going to them and saying that, hey, we have this one solution that'll put all your data into it. We're just simply saying, you know what, people are selling $350 worth of fake documents. We want to keep our people safe. Why don't you use this technology? And just a digital wallet that will just make sure that nobody's faking it. So we are keeping it simple. And I think blockchain is just like internet, right? Like we never really talk about Like, internet, we just talk about, okay, like you need more information, just go to my site. We don't say, hey, we have this cool technology called internet. So I think it's just like we have put so much emphasis on blockchain that we have really lost the actual essence of it. So in Africa, even before coming to Africa, if you see our site, we tried not to even use the word blockchain. We just said tamper-proof credentials, or something that cannot be easily faked. Because right now, one of the biggest issues we are dealing with is people are faking these and they're selling it. And that poses more of a bigger issue than anything else. So in Africa, I think simplify it, be like, hey, we don't want fake documentation. We want people to be safe in your country and outside the world. Let's just find a solution for that.
And so can I assume that the governments are really, is it resonating with the governments when you're looking at it from really talk about the solution versus the technology?
Absolutely, because here, as you enter the country, you have to pay, right? $25 for swab, and just to get the COVID results. As you are leaving, you have to pay $100 or something, $125. And a lot of people are just charging more money, and they're giving out fake things. So government is missing out on money. And government is like, hey, anything that creates transparency, we are down with that.
I love that.
So that's why they like it.
Always follow the money, right? Eric, I want to circle back with you now. This is actually building a very interesting discussion here, and I'm wondering where we're going to land today. But I'd like to have you chime in on what Sid and Alexis have shared so far.
Yeah, I mean, I guess first on the technology adoption front, absolutely. It doesn't matter how it's done. It's more about what's possible. It's selling the benefits of it. People like throwing blockchain out there because it's a new and novel technology and people are interested in it. But yeah, I can't remember the last time a client asked us to implement something and then they're like, wow, what kind of relational database are you using behind that? And it's kind of like the same thing, right? So at some point in time, when emerging tech, it'll lose its novelty. It'll just work in the background and do what it needs to do, which is where we need to get to make it understandable, because the rabbit hole of blockchain leading to, okay, now let me explain how cryptography works, and getting into that whole chain usually just leaves people a lot more confused. So in that sense, it's just, yeah, it's practically speaking, make something that resonates, make something that connects. It's all surface level. The gap is making people understand why it's different and that you can trust this, right? And I guess that's the one thing that we also have to be careful of here, is that without some degree of knowledge, or without a very controlled sort of verifier issuer kind of ecosystem with trust frameworks that you can kind of look at, it's also very easy to spoof QR codes. Like, I mean, that's one of the biggest faults, I think, of the technology, and using that right now is sort of like a visible way to prove something to the general public. I mean, you can create controlled verifiers and stuff like that, but it's very easy to create a fake looking document that someone thinks is real as well. So those kind of issues, I think, need to be sorted out with universal verifiers, with the verification side of things, with public key registries that people can actually sort of trust internationally, or make their own rules around more practically. And I think that then gets into sort of the other angle of this, and back to adoption and scalability. And that whole piece is pretty challenging from a policy perspective. I think it takes countries a long time to really sort of sort out how they want to deal with those kind of things. So Singapore, it was pretty easy. It's a nation state. They're pretty good at getting things done pretty quickly. They don't have the challenge that we have in Canada of like health data or anything seen as health data having issues when it crosses provinces or crosses jurisdictions, right? So they were able to put together a white list of here's the valid labs, here's the valid clinics. They were able to then throw that through Ministry of Health notarization service to get sort of like a master signature. And since generally speaking, it's a healthcare system that everyone could arguably trust, I mean, people just have to look for what's Singapore's signature. But as soon as you get into the other situations and the complexities of vaccines, even down to the level of, do I trust each vaccine accurately? Or do I trust the administration cycle of these vaccines? Was this actually deployed in a way that I trust? That ends up being, I think, a very complicated problem we have to tackle, is what's the trust anchor for this list? And then how do we make it flexible enough that everyone's going to have a different view of who do I trust on that master list? So it's some of those foundational things, which ends up into a sort of like a governance issue in terms of where does the overall whitelist lie? Is it someone like the World Health Organization? And yeah, that's where it gets probably to the point where deployment of this kind of stuff ends up being pretty tricky, world scale, but we're all trying to figure that out.
I think this is quite interesting that you're talking about this, because I mean, I traveled all over Asia, and especially in China, and fake everything, right? So we see that all the time, and really when it comes to blockchain system or any sort of identity system, it's garbage in, garbage out. Like if the information going in is not solid, it doesn't matter what system you have, you still have a problem. So what I want to do is just change the question a little bit here, and let's talk about digital identity first, because recently I got my 2 vaccines, so I was thinking the same thing, and I thought, oh, okay, let's try what Alberta is doing. So the first thing I had to do was create my digital identity. So they asked me a couple of questions, and I threw it in, and they're going to get back to me on it. And then from there, I can do my health records, right? So can you comment on digital identity and what your thoughts around that, and what is your experience around that?
Interesting question. I've spent a lot of time with BC Gov. In my opinion, extremely well thought out solution. They basically have created a system here. They have legislation that was passed in 2008 that put together a digital identity program so that there's a core database that is protected, which has the data, a common set of data, but it's divided up by programs and made sure that they're, for example, the health program has no visibility into anything that the driver's license system has, and things like that. So sharing the same core attributes, but making a protection separated. What's interesting is what aiming to do is enable the citizen to use that, so the citizen can take advantage of that without having to go back to the government every time they have to check something. So you go to the liquor store, you don't want to say, okay, call the government and check that how old I am. You want to be able to carry something that's digital, but that only you use, you control when you use it, you control how much you show. And that's really what we're trying to do with digital identity. That's one piece of it. The second piece is allowing others to use the same base technology so that you can be a lawyer and get a credential that says you're a lawyer that can go beside your identity piece and be able to present them together and be able to show that, oh, I've had a vaccine, and so I can go into the courthouse because I'm a lawyer, I'm a person, and I've had my vaccine. So, combining all of those things and allowing you to build them out in isolation so that everyone can still operate their own silos, but the citizen can bring them all together and present them out to give a picture of themselves for the business need necessary, and they can do it in a digital way. That's the type of thing we're trying to build out.
So you're trying to tell me that this is going to be better than me giving out my social insurance number and showing my photo ID, like my driver's license?
That is the big thing. I get a kick out of the and it's absolutely right, that you can say, what verifiable credentials do, which is what I'm deep into, is it takes away the, do you trust the person and the piece of paper they're presenting? You can absolutely trust that because you can do the cryptography behind it and make sure there's nobody's tampered with anything. It's, do you trust the issuer, which is the issue that Eric was getting to? Do you know who that issuer is? And on a small ecosystem, the government of British Columbia. Yeah, I can trust that. If I'm traveling and coming into the Netherlands, do they even know, the people that are looking at the piece of paper know where British Columbia is? Well, I don't know. And they've got to decide if they trust it. Now that's where trust frameworks and the stuff that Eric was talking about comes in.
And somebody talked about the internet. Oh, Sid, you were saying, about, I'm using the internet. I'm old enough to have lived through that era. And I'll tell you, one of the biggest trusts was SSLs, right? The secure socket layers, so that you can have e-commerce, right? And that certificate of trust, that who can you trust that issued the certificate that allows you to create the encryption? So we're really going back through that evolution again. Now, way back when was the e-commerce at the early days. Now we're being more sophisticated because we're talking about us as an individual, and we're going to lose that identity. So Sid, I see you nodding like a bobblehead. So I want to give you an opportunity to make some comments.
I wanted to comment because I also signed up for Alberta Health, right? And I was excited and a little bit disappointed. So I think Alberta Health is going in the right direction. And if someone from Alberta Health is here, I'm so sorry. It's a little bit bad execution. It's bad execution because there's no portability. So it's literally like you go on a site, I can see all my vaccinations since I've been here, and I can see a lot of things. Great. But if, just like Stephen was saying, now if I need to have, let's say, my education or anything else, I need 10 different apps, and there's no interoperability between these apps. So I can't really do anything. And plus, if I want to share partial information, selected information about me, I can't. I have to show every single thing. And I think so it's a step in a right direction, but I don't know how far along they have gone to pivot into what we are talking about, which is there should be level of ownership where what I'm sharing and how I want to use this information for my benefit as a consumer or as an end user. And I think that's where they're not thinking. It's just like, okay, this is it. You look at it, and they haven't figured out a way to use it more effectively, which I think we can use it much more significantly, how we share it with our doctors, how we share this with our insurance providers. And there's so many cool aspects we can use this with, but I think execution is lacking. And that's where, like, I mean, I'm trying to actually work with these guys. I'll be like, okay, use our solution for free or do whatever. Just fix it. Just fix it.
But
So
I'm going to challenge
I think
that, though, Sid, because what Stephen said earlier was fascinating. He's saying, like, separate the use. Like, you've got the healthcare information on the one side, travel information on the other. So what Stephen was saying earlier was separate, and so the question is, who should be responsible? And I think this is what Alexis and Eric was really trying to get to earlier. So who's going to be responsible for this? And so that they can say, okay, this information now is portable, so that it can be used for all these different aspects of who you are as a digital identity.
I think I'm saying similar point as Stephen,
Okay.
that Alberta Health is the issuer. Or like our doctor or the lab is the issuer. That's one portal. But we can't really do anything with that information, though. So, like, yes, you created a Alberta Health account. Now what? And that's what I'm trying to say. So something has to be enticing enough. It has to be usable enough. User experience has to be simplified enough to use it. And I think that's what's lacking. So I think, and there are multiple options, and there's a lot of research done on so many ideas that what can be done. But I think that's where we stop. This is a great solution. This is a great start. And I think a lot of people are behind it. Let's find a way to actually use it more effectively. That's it.
Excellent. Alexis, would you like to comment and jump in? I want to make sure you're being so polite, so I want to make sure you have time here.
Yeah, absolutely. I mean, as Stephen and Sid were talking, the thing that was really coming to my mind was that there are about 1 billion or so people on the planet right now that don't have any identification whatsoever. And we're talking about all of these challenges here of, bridging all of these siloed kinds of systems and, creating something that, is more effective than pieces of paper and faxes. And I think, when we do it here, when we're able to, roll out these solutions and show the benefits, it's going to allow an enormous amount of the world to just leapfrog forward. And I'm excited to see what that future looks like. I'm not a digital identity expert myself, but it just seems intuitive, that in the future, my doctor, isn't going to get a fax from the COVID testing lab, and that's what they're doing in Ontario. I was having discussions with some regions there, and the labs who are processing the tests have to fax the results, and some of that's regulatory, and it's kind of astonishing, but it's going to mean a lot for the world going forward if we can get this right.
Thank you. Eric?
I so agree with that.
Yeah,
I had to move my flight 1 week because of exactly that fax situation. Yeah, so I relate to it. Yes, that's it.
Yeah, and I think that is sort of the opportunity of technology. And like the verifiable credentials model is a perfect one. I think that's what we're trying to drive towards, is this whole idea of, as long as we segment it, as long as we layer it out, and we can all read this data package and understand how to validate it, then we're in a situation where data is just data. It can start crossing borders. It can move around, user at the center. on consent. There is an education component for sure, because I mean, selective disclosure is great. All these little things you can do with cryptography, amazing. My guess is 80% of the population, based on how casually they accept terms and agreements and check boxes and sign up for like Facebook and stuff like that, will just check all the boxes anyway and give everyone all of their data. So we can equip them with a great tool to protect privacy, but there is still an educational component to really sort of be like, hey, here's how you use the tool and why you want to use the tool. And I think that's going to lag the technology a little bit, actually. Where right now we're building very expensive consent checkboxes in some cases. We need to teach people to use these things appropriately. But absolutely, putting data in the hands of the user and in their control, regardless of the data across industry, credentials are just claims about anything. Putting that sort of in a person's hands, and this being a good example of it, it is a perfect sort of springboard for how this can work differently in healthcare. Exactly, because when we're talking about, again, regardless of usage and crossing border and stuff like that, holding a vaccine record is kind of like holding a mini health assertion, a mini health record, one small segment of it. That's not a big package. And it is very much that pattern. Then if you equip the person with it, and you can't share data between jurisdictions or providers or hospitals because of all the rightful data protections that are in place, and all you need is the user's consent. Well, this forces the user's consent. And if I can move my own data across the border by my own volition, then we've all of a sudden created those pathways that have been missing in healthcare, which is exactly why people have to still rely on faxes and phone calls and everything like that, because they don't have the user in the center, which is why these credential-based identity models, I think, have the potential to really change that once we sort of get all the trust framework stuff right.
Okay. So I'm going to just do two things here real quick, because I don't know how many audience we have here and so forth. So I'm going to ask the audience, I'm going to give you a little bit of homework, and then I'm going to take another topic and swing back to it and say, look, we've talked about the challenges with digital identity and who to trust and so forth. So, you know, whether the audience or our panelists, can we think of similar problems in the past that we as a society have helped solve that could be used as a springboard solution for us to address digital identity? So one of the ones that I cited was, you know, as the internet evolved, we had to figure out who do we trust in terms of domains and encryption so that we can have e-commerce. So there's a framework there that was created and has been used for decades now that we may be able to think about how we can use it. So I want to give it to the audience to think about, and then they can throw in the chat. I'll swing it back to it, and then we'll come back to it and discuss those. But in the meantime, while everybody's kind of brewing on that question, what I want to come back to our panels and say, okay, we've talked about all these problems. So tell us some real life things you've done that addresses maybe portions of what we talked about today. Say, this is what we're doing today, and this is what we're trying to address with our solution. So I'd like to kind of go around the table here and have you share a little bit of that, because again, the purpose of this webinar, and hopefully this webinar series as we move forward, are real life solutions, right? Not theoretical. So we don't just talk about the prompt, we talk about what we're trying to do to make a dent into getting to the solution. So again, Stephen, because you know I want to catch you before you go wine o'clock hour in the Netherlands. So I'm going to ask you to go first for us.
Okay, we're doing an awful lot of projects in various places. I guess the one I'll talk about is organizational identity. So corporations are people too, right? They have digital identity. You have to have a corporate paper. You have to register with your jurisdiction. You have to have a business license and so on. One of the areas we're seeing a lot is companies putting a program in place that enables companies to get their credentials, to hold their credentials, to prove them when they go to the bank. So instead of bringing their little piece of paper that shows they're an incorporated entity, they can actually present it digitally. They can have a digital identity that shows that they're a director of the organization. That can then extend out to what permits and licenses they've been given from the government, what insurance they have. Employees can demonstrate, that they have been trained in safety training, so that they can use that to gain insurance, reductions in insurance because they show that their staff has been trained. So all of those things, if you can trust the piece of paper that you're being given, or now this digital thing you're being given, you're no longer spending your time figuring out if you can trust this thing or if it's been faked and how real it is, but you actually have attestations that you can trust that come from issuers you trust. You can do a lot with it. That leads into supply chain. It leads into, stuff, food, ESG. We're seeing a lot of that in ESG, of being able to trace the sustainability goals, the greenhouse gas emissions produced when you extract things from the ground. Okay, how do you demonstrate that in a way that others will trust, that your clients will trust, that your customers will trust? Those are the things we're building up, and it all starts with what's the identity of the organization, what are the permits it's got, and things like that. They're all the same as what people have. So there's lots of stuff going on.
Oh, fantastic!
That's my example.
That's a really good example. Sid, can you top that one?
Well, I'll try it. I'll try it. Stephen is an OG. I can't top him, but I'll try. So what we have been working on, we started Rehuman with one simple aspect, that when people go for jobs, it's a painful process. And we are like, hey, there should be a better way for people to represent themselves besides going through multiple background checks. And what if we can just present our credentials and certificates and our attestations really easily? And especially when we are going from, let's say you are in Canada, you go to the United States, and they have to actually call your employers. It takes 4 weeks to get a job. And it's just a painful process then somebody else goes through. So we are like, hey, if we can engage what you call some of the largest staffing firms in the world, we can really bring some of the influencers to actually kickstart this. In North America alone, 60 million people go through staffing firms. So we were lucky enough to actually bring two of those large firms to do a pilot with us. And right now, that's something we are so passionate about. Especially, we didn't think when we started this back in 2018, 2019, that we will have such a high level of unemployment. And now our pitch to the government and other places is, so many people are out of jobs. What if people can get to work in 2 days as opposed to 6 weeks? That reduces the EI and CRB or whatever, like other assistance they're receiving, and that helps the government, also helps the individual without the painful process. So and we also included something, we try to eliminate hiring bias and discrimination during the whole process. So I think where we used it is so people can get to work much faster, not just here in North America, anywhere in the world. So
wow, I love that. And as you're talking, I kept thinking about healthcare workers. Healthcare workers from other countries who come,
yes,
and they ended up being dishwashers and Uber drivers when they are fully trained and experienced, but there's no way for them to show that they are really experienced and they have the true certification. So you may be solving another massive problem for us. So thank you, Sid, for that. I don't know. I think that's pretty good. To top to match it with Steve there. Alexis, just kick their butts.
Right. I want to echo what Stephen was talking about with the tremendous ESG application for these types of technologies, and it definitely comes down to trusted data, trusted counterparties, trusted verifiers. And I'm currently working on a really exciting project. Again, this is with Guild 1 in their area of specialization, the energy industry. Developing a system for the automated verification of the carbon status of energy production, and then the automated translation of that, those verified credentials, that verified carbon status into offsets and credits. So taking the information across this entire energy industry value chain, and then being able to create, market tradable value out of it in this seamless kind of process. I absolutely think that's the future. It's going to incentivize a lot of renewables development and a bigger ESG focus in the energy industry. I'm actually going to be speaking about this in Houston in mid-September at Blockchain and Oil and Gas down in Houston. So I'm really excited. So yeah, that's what I would say is an interesting twist, very similar to you, Stephen.
Wow, that is incredible. And I think as much as you're saying oil and gas, when we're talking about the carbon, we're talking about the, and the ESG and so forth. It brings it down to it affects all of us. Yeah, whether you want to talk about global warming or the importance of carbon recapturing and so forth. Like just
manufacturing, all kinds of other industries can use, the same type of process.
Yeah, that's. Thank you. Hey, gents, how's it feel to get your butts kicked? They're pretty good. At least Steve can just drink his sorrows away there, though, eh? Yeah. All right, Eric, take us home there. Give us the fourth solution. Geez, I all of a sudden feel so hopeful about the world's future because of you guys.
Good. I mean, we'll
no
stay on that
pressure on
track.
you or anything. Yeah. No pressure. Yeah.
And in that sense, we also do a lot of work with environmental consulting, climate change, and sustainability, which does occasionally tap into sort of some of the technologies we have. And really, when you start looking at some of these things, it is about creating incentive mechanisms to change behavior on the ground. And it is about then creating these ecosystems around trusted data. So that's a lot of the work we do with the United Nations and various developing nations, is actually sort of looking at how we can create incentive mechanisms and shore up origin claims about sustainable agriculture. And in that sense, it's sort of that exactly the same thing about, these are just claims about something. Claims need to be trusted. You need to have trusted data. You need to know who's making the claim. And that's where it comes back to identity. So it's the same exact thing. Instead of a vaccine credential, it is really sort of a sustainable practice claim. It's an origin claim. It's an auditing claim. That's the data package that then goes forward to gain market access and kind of create better behavioral channels, decentralize the market a little bit, and allow these individual co-ops and farmers and players to be able to access the real world market and international market instead of relying on all these sort of like middlemen, which cause all the fair trade issues. So very much it's a repurposing and application of this tech on one hand, because verifiable credentials, verifiable claims, great way to prove something, as long as you understand the trust framework behind it. And then on the other hand, also, when we're sort of looking at deploying things to new populations that aren't fully digital yet or in the transition to digital, I mean, what better chance to do it right instead of how we have been doing it with centralized systems in terms of giving people privacy preserving digital identities, ownership over their data. We don't need to create a registry of co-ops in Morocco or herders in Mongolia. We just need a mechanism that they can make provable claims on, and then they can get incentives and benefits back on with traceable data behind it to actually make this all work. So it's exactly that model of changing how centralized trust works, decentralizing the trust, protecting privacy, protecting data, and then being able to empower people to make provable claims about themselves. So,
what's really fascinating about what you just said, it kind of ties the four of you actually together, and where you're all focused on is how do you create that trust at the end of the day. And if you can hit that source of trust, then all the solutions can spin all over the place. And I do see on the chat there, I don't see any comments from our audience right now, and maybe they're still brewing. Maybe we can have my question for next time, which is, what are previous things that we have solved that could help us with this whole trust framework concepts. Although Stephen, you just put your hand up, so did you have an
I just
idea
wanted
that
to
you
throw.
wanna
I just wanted to throw one thing out that it's come back a few times to the trust framework and that. One of the interesting things I find about verifiable credentials to understand is that they really are replacing paper credentials. So every time you go to use them, you're really replacing a piece of paper. So you're eliminating, you're eliminating the paper, but B, you're eliminating that the paper was faked. So you always had this idea that often the focus was on whether the piece of paper was fake and not on where the paper came from. Now you're actually, with verifiable credentials, you can trust the paper, if you will. Now you can just focus on where the paper came from, and you can do that in, there's ways to do it. It is the hard problem that's left, but that elimination of somebody being able to forge a document, that's huge. Just wanted to throw that out.
Actually, that's a great comment.
The other problem's already been there.
That's a great comment. Like how our thinking of change and we didn't even notice it, right? It went from the paper versus now the source, right? And I think we're running out of time here. So if it's okay, I want to first thank all of you for taking the time to share your projects, your knowledge, and your insight with us today. And I just want to summarize that this discussion has really led to an opening of our minds that really the work, doesn't matter which angle you're coming from, is that it actually applies to all industries. Doesn't matter what industry we're in. It's not just healthcare. Even though today we said let's talk about healthcare to kind of kick it off, but I think where we landed was, if we can figure out the source, then it affects every industry, affects every country, affects everyone on the planet. So I would love to, with Kalea's permission, to see if we can create this as a new, like as a series of discussions where we can have yourself and other panelists come back and really drive deeper into this. And I want to call out Louis. I love your comments on the chat there, and we didn't have a chance to really jump in on some of those, but the one that really resonated is the social contract and the shift in attitude that we need to have. So it's really not just about the technology and the solutions, it's also about the education, about the individuals. Like, how do we get the messaging and really get the confidence to allow the social contract, if we will, to start shift things into the digital world with comfort. So we'll leave that as thought for future discussions, if that's okay. And yes, I am in the Matrix, and coming to you from the Matrix, Hubert Lau, your Asian chow boy, and and I am politically incorrect, and that's the way it's going to be. So thank you very much, everyone, for taking the time. Kalei, I'm going to pass it back to you. Thank you.
Awesome. Thank you everyone so much for joining us here today. Oh, sorry, my video's not quite working. 1 second. Awesome. Well, thank you everyone for joining us here today. That was an amazing conversation. I loved all of your points. Our next webinar coming up, I believe, will be actually our roundtable. So if you guys are interested in learning all about custody solutions in terms of what's happening in the fintech space, please join us on July 22nd. We'll have a lot of industry members and regulators there having some really fascinating discussions. So thank you so much and look forward to seeing you all again soon.
Thank you, everybody. Bye-bye.